you're fine in your 9-to-5 job if everything goes as planned and as you expected it. If anything goes unexpected, people feel unsafe. They'll often go home, doom scroll on their phone, and watch a marathon of Netflix in their safe space with their safe blanket on their safe couch. And that is functional freeze.
That's freeze.
That's functional freeze.
Wow. Okay.
Or parasympathetic emergency, indecisive, hopeless,
What if
helpless.
people do that every day? Are we in emergency mode every day?
So many people.
Oh, man.
So many people. So many people. And I mean, vagal nervous dysfunction we have shown is anything from ulcerative colitis to inflammatory bowel disease in the lower vagal tone, all the way up to mental health issues, depression, anxiety, palpitations, EDS, all this kind of stuff is connected to vagal tone and vagal nerve dysfunction.
So many people today, men and women and even children, are experiencing chronic fatigue, unexplained weight gain, anxiety, and hormone disruption, but are told the labs are normal. What if these symptoms are a byproduct of hidden infections, mold exposure, parasites, and environmental toxicity disrupting the body from the inside out? My guest today, Dr. Jessica Peatross, is a pioneer in functional and environmental medicine. She is known for uncovering the root causes that conventional medicine often overlooks.
And so when you look at this chart, all the neuropeptides, the neurochemistry, the hormones are released differently in the body when you're not in a homeostasis. Everything. There's not a pill to fix that. So I can half the time of drainage and detox for people if I get this right in the beginning with their nervous system. And many of them say, I feel safe here. My body doesn't feel safe.
We will explore how toxins, stealth infections, and dental health play a major role in hormone patterns, mood, energy, and inflammation. We will also talk about medical gaslighting, which honestly applies to all, men, women, and children, and how we can all advocate for ourselves, and practical strategies to detox safely without overwhelming the body. If you have ever felt ignored, dismissed, or stuck with unexplained symptoms, this conversation will give you answers, tools, and clarity on what to do next. Please join me in welcoming Dr. Peatross, Dr. Jess, to the show. Okay, before we jump in, quick health check. Are you subscribed yet? You'd be surprised how many people forget the one click that actually helps them feel better every week. Go ahead, hit it. Around here, we turn science into self-care you can actually use. Let's get started. All right, Dr. Peatross, welcome to the show. Well, you've been here like 10 minutes and I already feel like I have a new friend. It's really, you've just got this energy. I love it. We're going to call you Dr. Jess for the rest of the show.
I think that's how I'm known, sure.
So here, like a lot of my invitations onto the show are partly selfish, partly motivated by patients, but one of the things that I would love more education on personally for my patients and for myself, but I also think I don't see it being talked about enough kind of in the grand scheme of things, right, is the role of the environment on our health. And we hear a lot about detoxing. We hear a lot about maybe someone over here is talking about mold, someone over here is talking about pesticides, somebody over here is talking about, cosmetics and clean beauty and all these different things. But we're not hearing about it in the exam room. And we are not kind of sinking our teeth into how we understand that as clinicians and even as patients. What do we latch on to? What is a lot of noise? Where do we go from here? So that's why I wanted you on the show, because I know about the work that you've done. And I would love for our audience to learn a little bit more about you and a little bit more about kind of your perspective of the environment and health as somebody who's been practicing medicine.
Yes, absolutely. Thank you for having me too.
Of course.
So I am a traditionally trained medical doctor. I was trained in internal medicine, previously board certified, not anymore. And I worked in a hospital as a hospitalist for almost 7 years before I started to see cracks in the system. And you know how it is. I was discharging people on 30 or 40 different medications. They were feeding factory farm meat and Pepsi and Coke to people in the hospital, Jell-O, all that stuff.
Oh, yeah.
And it just wasn't aligned with me anymore. So I jumped ship. I probably would have been a little bit more conservative about it had I known that I was going to make a fourth of what I used to make in the hospital. And none of your insurance and malpractice is taken care of. It's all kind of like you have to kind of jump out of the plane and build the parachute on the way down.
That's a scary shift, by the way. So I also had to make that decision, because I was in the ER like we were talking about.
Yes.
And I remember I specifically told my husband, I'm like, I'm not going to make the money that, that I make working these ER shifts. So we need to sell the car. We need to get rid of like all this other stuff. No more like lattes and coffees at Starbucks. Like I go, we've got to clamp down on the budget. And he's like, okay, sure, whatever, and I had no idea that I'd be as busy as I got. And I'm sure the same thing happened to you, but anyhow.
I mean, I suffered for a while, but you're braver than me. I didn't have a family to take care of. So that's very brave what you did.
Well, I credit him with that. I've got to
Really?
say, I credit him. He's the one who was like, go, don't be scared, go, we'll figure it out.
That
So
was
I've got to give him a shout out on that. Otherwise, I don't know
It's a good man.
that I would have had the courage to do it on my own.
Yeah, it was scary, me by myself even. And, I got trained by different medical doctors in the holistic world, naturopathic doctor, and really everything took off after that. And I love my job now because I actually take people off of medicine rather than put them on. And I really try and get to the root cause. And what you mentioned was part of the root cause that I look for. We now know in the science and in medicine, it's starting to come out that the environment signals the changes in the genes.
Right.
And it talks to us every single day. We're getting inputs and outputs from our environment. And really, it's our nervous system that's taking everything in from the environment. What I've noticed in my career as I've gone on, and this was not something I knew right off the jump. I had to really get in and kind of talk to patients and providers. They've really been my best teachers. And what I've seen is that when people are in flight or fight or freeze, which we live in such a toxic society with toxic work and chemicals and everything everywhere, it's really hard to keep your nervous system feeling safe, your body, your mind feeling safe. And when you don't feel safe, your body feels in threat. It contracts and it doesn't release toxins like you want it to. An example of this is people are in flight or fight. It's the opposite of rest and digest. So they're often constipated. They cannot poop, which is a way you release toxins. They often can't sweat in a sauna. And this is me saying, when you're stuck in flight or fight, your body contracts, it doesn't feel safe, it doesn't release as well. And so I start from the very beginning with every single patient, working on them feeling safe in the body, mind, and environment, because then it's a lot easier for me to complete a successful detox later on for them. So, and that means I have to dig into their history, their trauma, their antecedents, their triggers to see where things begin to unravel on their health journey.
So you're starting at a different point, right? Like a lot of people start with, well, I've got this lab report back. Or, like I mentioned in the beginning, like I've been exposed to mold, I've been exposed to X, Y, and Z, so I need a detox. But you're actually, correct me if I'm wrong, I feel like you're starting on the other side where you're saying all of this stuff has triggered not an autoimmune, but a vagal response of some kind, or a cortisol response, maybe that's the better word.
Or a histamine response.
Or a histamine response. And we need to start there.
Yes.
Why does that approach make more sense than starting down here where we're dealing with the actual chemical or the actual toxin or the actual issue?
For me, the toxin or the pathogen is not root cause. It's the trauma of the body. When you look at sympathetic and
Okay, wait, we got to say that again.
Yes.
Say that one more time, because that is a different statement. The
Yes.
toxin is not the root cause.
Correct.
It's the trauma of the body.
Correct.
Wow. Okay.
Correct.
Help us understand that.
Yes. If you look at the, I have a chart. I wish I could show it to everyone right now. It's for flight or fight. When you're parasympathetic, or according to Stephen Porges' polyvagal theory, when you're in ventral vagal, which is the tone of the vagus nerve. The vagus nerve is the nerve that comes out the medulla oblongata on both sides, comes down, innervates or sends nerve branches. I like to say sings love songs to the different organs on the way down. The thyroid, the thymus, the heart, the lungs, the liver, the small intestines, all the way down till it terminates. And the vagus nerve has to be a certain tone. That way it works properly in releasing chemicals throughout the body and firing properly. And so when it's not in the right tone, people feel indecisive. They're hopeless. They dissociate. And as you move from flight or fight into freeze, this is considered a parasympathetic emergency. Now, let's practically describe what this looks like to people.
Absolutely.
You're fine in your 9-to-5 job if everything goes as planned and as you expected it. If anything goes unexpected, people feel unsafe. They'll often go home, doom scroll on their phone, and watch a marathon of Netflix in their safe space with their safe blanket on their safe couch. And that is functional freeze.
That's freeze.
That's functional freeze.
Wow.
Or
Okay.
parasympathetic emergency, indecisive, hopeless,
What if
helpless.
people do that every day? Are we in emergency mode every day?
So many people.
Oh, man.
So many people. So many people. And I mean, vagal nervous dysfunction, we have shown, is anything from ulcerative colitis to inflammatory bowel disease in the lower vagal tone, all the way up to mental health issues, depression, anxiety, palpitations, EDS, all this kind of stuff is connected to vagal tone and vagal nerve dysfunction. And so when you look at this chart, all the neuropeptides, the neurochemistry, the hormones are released differently in the body when you're not in a homeostasis. Everything. There's not a pill to fix that. So I can half the time of drainage and detox for people if I get this right in the beginning with their nervous system. And many of them say, I feel safe here. My body doesn't feel safe.
So how do you know the difference between, because I feel like this is not a conscious awareness, right? How can we help somebody understand that their body's transitioning from feeling safe to feeling unsafe?
Absolutely. They start sleeping deeper. They can get into rest and digest and get into a deep sleep. They can be more emotionally regulated in the storm.
Safer states.
Correct.
Okay.
Correct. So if they get bad news, something that normally would have rattled them, they have the emotional regulations like a tree in the storm, right? Resilience.
Yeah.
They can eat foods they couldn't eat before because their body feels safe. So many food intolerances or histamine reactions because the body doesn't feel safe anymore.
So the rise of so many of these disorders that we see today, right? Like MCAS, mast cell activation syndrome, gluten sensitivity,
That's right.
Dairy intolerance, candida.
Yes.
What would you say to all these diagnoses that many of us are making kind of day in and day out?
Listen, drainage and detox, there's a place for it. It's still important. But oftentimes people suffer through this because their body isn't prepped and ready. If I can make their body feel safe, it's going to accept the detox easier, and it's going to half the time, because if I can get you regulated, your body is a healing vessel. It is meant to heal. If it is in homeostasis, I'm the problem. I just need to move roadblocks out of the way so the body can heal itself.
Oh, wow.
That's it.
So the ventral vagus is one part of the vagus, right?
Like, it's a tone that the vagus nerve is
Are there
in.
other parts of the vagus nerve
When you
that
move
we need
up
to be thinking about?
Yes, when you move up into flight or fight and into parasympathetic emergency or functional freeze, that is called dorsal vagal tone, according to the polyvagal theory.
Okay.
And that is really where people feel their body is so unsafe, they can't even hardly get through their day sometimes. I've seen people bedbound because of their nervous system.
Oh my gosh.
Yeah.
So we have the dorsal vagal, and is there one more part?
There's just ventral and dorsal.
Those are the two main parts.
But we really want to aim for ventral.
For ventral.
Yes.
Okay. So if we now can wrap our heads around this and understand that it's the vagal nerve, the ventral vagal area, that's sending messages to other organs and tissues in the body, right? Correct me if I'm wrong.
Yes.
It's sending messages to other organs and tissues in the body, putting it in fight, flight, or freeze mode. What's happening next within our bodies?
Yes. So I'll tell you a little bit more details before we move on. What we've shown is that epinephrine, or adrenaline, is released in the bloodstream during a flight or fight response. However, it cannot cross the blood-brain barrier. So we didn't know how a lot of these fear consolidation memories were happening with the vagus nerve when things happen. What we now know is that epinephrine, or that response, can trigger the nucleus of solitary tract and have it release norepinephrine. And that is what triggers the vagus nerve to consolidate memories within the limbic brain, or the part of your brain that stores traumatic memories or fear, right? And so that consolidates that memory based on when the vagus nerve does that. So we have connected it to our fear and our memories. In our body, however, you were asking what happens next with all this. How do we function?
Right.
So what happens next when we're in dorsal vagal is some people stay there their entire life, unfortunately, and they will continue to get these labels or diagnoses from the system, and then not have solutions for themselves because they're put on a medication, which often band-aids the problem.
What are some of the common diagnoses somebody like this might get?
Chronic fatigue syndrome, POTS, postural orthostatic
epidemic. I'm seeing a ton of POTS in the practice.
Well, you know what COVID did.
Yeah.
It really activated histamine and mast cell activation syndrome for people. It really put people in dorsal vagal. It absolutely did. It causes a cytokine storm just like mold does. They're very similar that way. And so I've seen a huge rise in MCAS and histamine since 2020.
Since 2020. Fascinating.
Yes.
All right. So those are some of the diagnoses that we're seeing as somebody's in this particular state.
There's a lot more too, obviously. I mean, just brain fog, fatigue, joint pains, digestion problems, problems sweating, problems going to the bathroom. I mean, all these vague symptoms people have. I mean, things like Epstein-Barr virus and COVID, they're reactivated by each other, and they live off adrenaline and cortisol in the body. They live off that state of stress.
So that is something that I've not heard before.
Yes.
And I've been in the space for a long time. That reactivated, I've always talked about Epstein-Barr and Lyme as more of like autoimmune diseases, because I think we all get it, you know, most of us, if we've had it, if we have a good immune system, we fought it off, it's now dormant. But we saw that with COVID too, by the way, that you have this reactivation, right? And that reactivation, I've always said, is usually because some other terrain in the body is not where it needs to be.
That's right.
But you're actually connecting the reactivation to adrenaline and cortisol.
Yes, because everyone knows if you're going to get a cold sore, oftentimes it's when you're stressed or around your cycle or you're sunburned, right? Because these herpes viruses often live in the nerves. Right? Like herpes 1, herpes 2 come out in the same pattern or same dermatome. They're in the nerves. That's the nervous system.
Fascinating. So, okay. So how, I have so many questions. All right. Question number 1 is, as a provider, as a clinician, and I'm treating you, the patient, and you're having all these different symptoms, right? And I'm creating these treatment plans and I'm trying to put things together. How do I know that I need to start with the ventral vagal system before I start doing things for MCAS, or I'm just making this up, MCAS or POTS or whatever else? How do I make that clinical decision?
Honestly, the biggest reason I see MCAS, histamine, and all that stuff is nervous system dysregulation, followed closely by mold and COVID. So I almost start every single person in this pattern in my practice. You know, we're all different. We're all unique and bio-individual, but we still have the same feelings, emotions, organs, things that run the same in the body that need to be tailored bio-individually for us. So oftentimes I'll put people through a nervous system dysregulation part of my program at the very beginning. And some people need shorter and some people need longer, but I always go through it with them. Because if you have a chronic illness or label, then chances are your nervous system is not in homeostasis. It's very rare that I see someone who is in rest and digest and still has a chronic illness.
Interesting.
It's very rare.
So then what do you do next when you identify? And how do you identify? Are you using certain parameters, lab test, physical exam? Like, how are you identifying?
Yes.
And then what do you do next?
So everyone who comes through my clinic gets a total tox test from Vibrant Labs, and that checks for mycotoxins, environmental toxins like pesticides, Roundup, phthalates, plastics, and heavy metals. And they also get a pretty intensive blood work panel. So it's a really an inflammatory-based panel, so I can look at things that might be driving the system, right? I definitely check a CRP, ESR, homocysteine on everyone. I always check CMP, CBC, vitamin D, full thyroid, full iron panel on everyone. And that lets me see how some of their drainage pathways or organ systems are doing, as well as the inflammation within the body. And usually if people are in flight or fight, they have some level of inflammation that's picked up on one of those lab tests. On top of the questions, I spend an hour asking them and talking to them about their history. And I start them in childhood. Did you have a happy and healthy childhood? And have them give me that timeline all the way through into the present day. And I note the antecedents, triggers, and traumas that occurred before a physical diagnosis every time for these people. So that's really important to do.
Well, there's that ACE report, right? Is it the ACE scoring, where if you've had childhood trauma, you're more than likely to have an autoimmune disease or a chronic disease of some kind? What's happening there with childhood trauma and then the expression of some of these disorders?
I think it's changing the methylation epigenetically on people's genes.
As they're going through life.
Yes, absolutely. And I can give an example for myself.
Yes.
In 2017, I got a Dutch test, which is a hormonal test, but on there it shows you your level of methylation because it's in phase 2 liver detox, right? And I had almost 80% methylation in 2017. I went through 7 years of hell and trauma where I lost my license. I surrendered it. I was sued 3 times. I had a miscarriage. My 6-year relationship ended, and then my dog died of a brain tumor.
Oh, my God.
And that's just the major issues that happened. And so at the end of that, I got a Dutch test in 2000. I think it was last year, 2023. My cortisol was completely flatlined, and I had 0 methylation.
So methylation is not static.
No.
So these things are not static.
No.
They're happening in real time.
Absolutely. And so that changed my ability to methylate based on stress. We already know we can strip magnesium and B vitamins during stressful times with high cortisol. So
Okay, I'm in shock right now. I'm sorry. I need a minute. Like,
time out.
I see, how many patients have we seen? 60, 70,000 patients through our clinics. And I think the ideology that we have is you have this gene, therefore you're a poor methylator, therefore you need this plan. You're saying it's like flexible in real time.
Just because I have MTHFR alleles does not mean they're activated. Doesn't mean they're turned on. Doesn't mean that, think about that.
Yeah.
I mean, I know people who had a slow COMT gene, which is the ability to break down adrenaline and things quickly, and they've reversed it. 1,000%. You can reverse these because the environment signals the genes. So if we can have negative epigenetic changes, by God, let's give people hope.
We can change.
Yes.
That's like an incredible message right there, because so many people park on their genes. I've got this gene, therefore this is going to happen. I have this gene, therefore that's going to happen. And you're saying that these genes are mutable and they can change and they're flexible, all these different things.
I mean, obviously you have a full genetic change that came through the parents. It's not. But if it's epigenetic, absolutely.
Yeah. That's exciting news.
It's wonderful news for everyone.
So going back to the exam room, so you're doing all these, sorry, not to sidebar you there, but I was like, wait, we got to talk about this.
Yeah.
So anyhow, so you're doing these workups, you're going through these labs, you're talking, through all the different issues that a patient's having. Where do you go with that person next?
So
after looking at their childhood trauma, kind of what their ACE experience has been.
Absolutely.
What's next?
So then I basically tailor my nervous system regulation program to that person bio-individually. Some people, let's give, for example, I love liposomal GABA as one example. Yeah. With L-theanine, phosphatidylcholine, it's amazing. But some people have a GAD mutation, and they turn GABA into glutamate. Yeah. So it has the opposite effect of calming on them. It makes them hyper excitable, which we don't want.
Right.
So that person couldn't have GABA, right? I also love high dose minerals. Nerves fire because they have a potential or a charge. So if you don't have a charge for the nerves to fire in the nervous system, it's not going to work properly. And so many people are demineralized. They're taking binders. They're in the sauna all day without remineralizing. They're stressed out, which makes you dump minerals out the kidney. It's why your heart rate and blood pressure goes down when you're in dorsal vagal. So remineralization can really help stabilize MTHFR. It can stabilize the nervous system for people. So that's one of the first things I do is get them on high dose minerals. Now,
is there a specific mineral deficiency that you're noticing over and over again?
Yeah, some people have a calcium shell, which is sodium, potassium, magnesium, and calcium on some of the hair analysis tests, which means they are in sympathetic overdrive or flight or fight.
Interesting.
And so then that's kind of a test that's a dead ringer for people if you need to know if they don't believe you. Because a lot of people don't want to believe. It's just their nervous system that could be doing
this. I can
this.
imagine. Yeah,
it's hard.
Can imagine. What are top 3 things that you can pick up in lab work to tell that people are in fight or flight?
Homocysteine.
Okay.
100%.
Where do you like a homocysteine level?
I'd love it below 10.
Yep, me too.
I'd love it below 10. Okay. So yeah, that's important. I also can tell oftentimes from the MCV and the CBV in the CBC, the mean corpuscular volume lets me know that they need B vitamins if it's very, very high.
If it's high. We get a lot of high MCVs. Same. For those of you that are patients, you know that. But like high MCVs are in your CBC. This is a basic lab test though, by the way, guys. This is like a CBC. This is not fancy testing. You can do it anywhere and kind of understand what's happening there. Okay, CBC, what homocysteine CBC was a third?
It's probably a thyroid panel too.
Okay.
Reverse T3. I always get TSH, free T4, free T3, TPO, TG antibodies, and a reverse T3 on everyone. And that lets me know, especially if their reverse T3 is 20 and above, if their free T3 is really low, I know that their liver's in trouble because they're not converting. So that's the thing. When your nervous system dysregulation, everything starts to kind of unravel over time. So you can start to see it in all the labs where it's affecting everything.
Do you ever look at morning cortisol levels, or are those helpful, not so helpful?
I think so. Okay. I've had a few patients bring me blood work in, and their morning cortisol and blood work is sky high. And I'm like, wow, okay. But oftentimes it's not a test that I have everyone run through when they come in the clinic. But one of the tests I often order on top of everything else is a hormone zoomer or a Dutch test. And that definitely lets me know about their morning cortisol flatlined or high, or if they have a paradoxical where, they're flatlined in the morning and then their cortisol goes up at night and they don't sleep all night.
What else are you seeing hormonally that can identify that someone's in fight or flight?
high estrogen as well. Cortisol will pull those sex hormones out right away. It'll pull the blood sugar out too. So I can often see it in dysregulated blood sugars, hemoglobin A1C. I can see it in high estrogen or estrogen dominance, low progesterone, or, it's actually the ratio that matters, right? On the Dutch test or hormone zoomer. Sometimes testosterone can be involved too.
Do you feel like testosterone, like low testosterone in men, is connected to this nervous system regulation issue?
For sure, I think so. And the basic building blocks that people need to make testosterone. It's a very laborious process for the body to make some of these hormones from cholesterol. So
yeah, and the overcorrection of cholesterol too, I think, is a big player in the declining testosterone levels as well.
Don't even get me started. I know.
So, okay, so I'm the patient. You finally convinced me. It's my nervous system. I'm having this parasympathetic issue. What's the solution?
I mentioned GABA, I mentioned minerals, but we can't have a pill for every ill. It just doesn't work that way. I wish it did. It'd make my job a lot easier.
Just take this. You'll be better tomorrow.
I wish. What a miracle worker then.
Yeah.
No, it's the hardest part of my job because think about how hard it is to change me. I'm asking someone else to change.
It's hard.
It's difficult.
Yeah.
And, the brain has hardwired itself because neurons that fire together wire together. So it's hardwired itself to protect this person. And it probably did for a while, and it's no longer serving them. So it's a lot of stop being a human being and become a human, or human doing and become a human being. Really learn to sit still. Don't doom scroll on your phone and dissociate. Really learn to be with those uncomfortable emotions. Some people need somatic work. They need breath work. They need a vagal nerve stimulator sometimes. They need to revamp their life because money isn't everything. Your health is more important. Sometimes that needs to be said. Sometimes can't mitigate it as well as you'd like because they're taking care of their sick parents. They're working a full-time job. They have 3 kids. It's like, how can you make someone feel safe when life comes at you like that? So oftentimes I'll recommend a nervous system program called Primal Trust by Dr. Kathleen King, who was bedbound because of her nervous system. And she does 20-minute programs every day teaching people how to get back in their body and out of their head because really that's the problem.
And how do you do that? Like what's a simple way? Is it back to like meditation and journaling and some of these the problem is like there's so much conversation about all these modalities out there, right? That it almost is like it feels like it's not real or it's not really going to have an impact.
It does.
So if we were trying to structure a vagal nerve reset or a nervous system reset for somebody, that was kind of grounded and directed, like how would you structure their day? What are some of the things that you would really advise them to do maybe as a part of the morning, as a part of the evening? Because the other thing, like people want to accomplish things. They want to do things. They want to have families. They want to have careers, right? They want to do big things, whatever they want to do. So we don't want, like I'm always saying, I don't want you guys to not do the things you want to do or be the person that you want to be. I just want you to be aware of some of the blind spots and then how to structure your day, your week, your month, so that there's a little bit of a cyclical rhythm to it so that there is opportunity to reset this nervous system. How can we help people do that?
So it really depends on the person. I'll give you an example.
Okay.
I have a patient right now who's had multiple traumatic brain injuries from combat. And he's not sleeping. He's not going to the bathroom. He's having panic attacks and being suicidal half the day because he's so distraught from his brain injuries and his nervous system dysregulation that's catching up with him over the years. So for him, I suggested neurofeedback because there's not going to be a talking over, with me to be able to beat this. He needs something extra on top of it. So like a series of neurofeedback I really like. I went and did this for myself after I had a traumatic brain injury, and it changed my life. So, I can help.
What's happening with neurofeedback? Talk about that for a second.
So you have electrodes attached to your head, and it's actually giving feedback to your brain, right? To change your actually, what I did, the one I did, I watched a movie that kind of went in and out, and the sound went in and out. And at first it was really annoying to me. But over time, I acclimated. I didn't even really realize it was happening anymore. So it's such a pleasant therapy.
Yeah.
You're sitting there watching and
so
listening.
You're not talking.
No.
You're just watching and listening.
And it's giving feedback to the brain. I slept like a dream
Wow.
that week. And so things like hyperbaric oxygen, neurofeedback, somatic work, primal trust, Tai Chi even.
Yeah.
Stuff like that. Meditation is great, but some people don't even have the bandwidth to do it because they're so
wound up.
Yes.
Yeah.
So you have to really know the person and what would be okay with them. A lot of people, I like tapping. Like, for example, I had a patient come on last week. She was full body eczema.
Mm-hmm.
She was a painter and she couldn't even hold the paintbrush because her hands were so swollen, bawling, crying. And she didn't want to hear it. I said, this is your nervous system. Listen to me. This eczema all over, hives all over, this is a histamine release. You're having food reactions, histamine release. You're crying. You're not emotionally regulated. You're literally in a histamine flare.
Yeah.
And so I had her on the call. My body can heal. My body is smart. My body can release in other ways. It doesn't have to erupt like this. By the end of the call, she was smiling. She felt empowered. I couldn't believe, she's like, I didn't believe that it was my nervous system. And that little exercise showed me how much that calmed me down and empowered me. Even just tapping, emotional freedom technique, and telling yourself something, because half of these people, they're perfectionists.
Yep.
They're
overachievers.
That's right.
Yeah.
That's right. And so your body, nobody can be perfect. It's too much on your body. So just the things that we say to ourselves, we wouldn't be friends with people who said this to us. So when you say nice things to the body and tap it out, release that energy, people cry. Because it's the first thing they've said something nice to themselves in years.
Yeah. I see that all the time.
Yeah.
You know, I'm also thinking about some of our viewers and listeners who may have families, and they can identify sort of this parasympathetic dysregulation or vagal dysregulation in somebody that they love.
That's right.
What's the best way to advocate for them, whether it's a child, a teenager, you know, a partner? Like how do we set sort of a healing environment or guide some of these folks if they're unaware themselves or not ready to be aware, and to kind of accept, like you're saying, your patient not really ready to accept that, like, this is your nervous system and nothing else.
It's very hard. It's very, very hard. And sometimes if the family is willing and able to help, sometimes it helps to coming from multiple family members in a very kind, gentle, thoughtful way, right? Because this is something that a lot of people don't want to hear. And it really offends some people to hear that they are the ones that their body is making them sick because of how they're responding to the world. So sometimes it takes me multiple appointments to chip away at someone and talk to them kindly and show them charts that I was talking about earlier and evidence and science to actually convince them of this. And sometimes they don't believe you until you get them on the supplement or a protocol or some sort of program that shows them how much they improve when they're doing
over
it.
time. Do you like tools like this, like an HRV?
I love it.
Tracking that and maybe being like, see, like, look at your HRV. It's not quite where it needs to be.
Actually, I just signed on as medical director in a clinic called We the People in Venice, Florida. And that's one of the screening techniques they're going to do is HRV at the very beginning. And I can't say enough good things about that. That's heart rate variability is extremely important to showing us how the nervous system functions.
Where do you like that number for tracking? Is there something you like?
Age, really.
Well, it's important because, like, my own daughter's asking this question, like, she's 17. Like, where should my HRV be? What would you tell her?
17, I would say 70s.
70s.
Yeah.
Okay.
80s, something like that. Like mine is now like 40s, 50s.
That's where I hang out usually. Yeah.
As you age, it gets lower.
Yeah. And then what's a like flashing light, alert, warning, HRV level?
Well, you don't want it too low. I would say in the teens. You have to be careful. I have a good friend who's in the 170s, 160s.
She's at HRV in the 160s? Okay. Gotcha.
And she's great, but we still aren't really sure what that means. If it's negative or positive, I've never seen it that high before.
High. I don't think I've ever seen that number that high. HRV, by the way, guys, is heart rate variability. It's looking at the changes in your heart rate given, you know, different stressors or different situations in life. And it's a great way. The lower your HRV, usually I historically say, the higher your cortisol, you know, the more adrenal dysfunction. The higher your HRV, usually you're in a better kind of parasympathetic
and
state.
I saw
overall.
that as well with all my trauma. My HRV was higher. And as I went through the trauma over the last 7 years, it definitely has lowered. And then, you know, I got the Dutch test, which confirmed my flatline cortisol last year. So it does actually tie in.
Ties together. All fascinating. Well, let's move more. So we've got this nervous system component that's really important to healing and to getting better. And reversing some of these reactivated viruses, infections, toxins, all of that. You started our episode today talking about toxins having that same traumatic kind of adrenaline, cortisol disrupting effect on the body, just like a stressor would, right? Just like maybe processed food would or things like that. As we move, though, through, and once we accept that and start to work on that, do we still need to work on the other detox pathways, the lymphatics?
Yes.
What's sort of the next steps in recovering from an environmental illness?
Absolutely. It's kind of like what came first, the chicken or the egg,
Right,
right? People
right.
can
It's
be
all connected.
It's all
Yep,
connected.
yep.
Yeah, people can be stressed out because of their environment or toxic society. They can be stressed out because they have a self-pathogen,
Right.
right? They have or mold in their house, water
Right,
damage in their house.
absolutely.
Great reason to be dysregulated.
Yeah.
So, of course, that stuff still matters. And there's a time and place for it as well. Oftentimes, the first couple months, I'm working on nervous system, but I'm bleeding and drainage too. And so what's drainage?
I was about to ask you
Yes.
that.
What's drainage?
What's
So
drainage?
You all have drainage pathways or detox pathways. And these are things like the bowels, the sweat pathway, cycles for women, the liver, the kidneys, the lungs, all of these things, bile, all of these things are drainage pathways, and stagnation breeds disease. So we want things flowing in the body, right? We want our energy flowing, we want our organs to be able to release things that we pick up every day. Because when things go in you and they don't come out, this stacks in your toxin bucket till you get a label. So it's really important to be sure if things come in that we don't want in, your body goes, oh, we see you. We can filter you out and remove on. But people say things to me like, you have a liver and kidneys, you don't need detox.
Right.
To which I say, what's non-alcoholic fatty liver disease then?
Yeah.
It's a stagnant liver.
That's a stagnant liver. High blood sugar, high insulin, all the things.
Exactly.
Right? Yeah.
That's just not your genes. I'm sorry.
Yeah.
So I work on that. And most of the time in Western countries, the problem child is the liver.
Right.
Sometimes it's the bowels. Lots of people constipated because often they're stuck in flight or fight, not rest and digest.
Yep.
And then a lot of people tell me they glisten and they don't sweat. And that's not really great either.
You want like a sweat.
I want them to be able to sweat in 10 to 15 minutes in a sauna.
All of those are ways to detox the body, right?
Yes.
Are there any other tools somebody should be using to really improve their liver health? Because I feel like the liver, again, I do a lot of Chinese medicine, Ayurvedic medicine, have loved that stuff.
I love it.
But they talk a lot about the liver, right?
Yeah,
they
absolutely.
put more emphasis on the liver than we do in Western medicine. And one of the things they talk about is the relationship between cortisol and the liver. They drew that together way before we started testing hormones, right? 5,000 years ago. So they talk a lot about cortisol and the disruption of, they didn't use the word cortisol, but the disruption of cortisol essentially, and how all of that is stored in the liver.
Yes.
The liver holds anger.
Yes.
The liver holds like stress essentially. And with enough emotional burden, you disrupt the liver meridian, which then in turn impacts your hormones, your mental health, all the other things.
Your
Gallbladder, all of it.
Yeah.
So that's the Chinese medicine interpretation of it, which if we apply to modern day, sort of clinical work in the Western world, you can actually see those things work together. You can see the liver meridian if you look at a pulse or tongue or face, and then you can look at labs and see high cortisol, and you can also see the liver enzyme starting to go kind of haywire a little bit. So I've been thinking a lot about this, and I'm so curious about what you have to say. When we want to detox the liver, if we accept that the nervous system and cortisol regulation is a part of it, what are your favorites? Like, what's easy? Like, does everyone have to do like a 28-day detox and IV glutathione and like all this stuff? What is an easy way to clean up the liver that everyone can do?
Well, I give a lot of people heavy liver detoxes with their drainage while doing nervous system work. Because, one way to connect the liver and just to go real quick, one way to connect the liver and cortisol is if you're hypoglycemic, low blood sugar, at night you spike cortisol and wake up, right? That's how they're connected. So I see this so much. You're exactly right. So the liver, I really like things like castor oil packs.
Yeah, I
Get in
love
the
castor
sauna,
oil.
put on a castor oil pack in your right lower quadrant, or right upper quadrant, and then basically you just sit and it pulls things out with castor oil. I also love things like bitter herbs. The liver is a bitter pathway in Ayurvedic. And, when you think about the American diet, what bitter things do we have? Sour Patch
Very
Kids.
limited. Yeah, very limited. Yeah. Sour Patch Kids. I'm not sure that counts, does it?
Yeah, no, it really counts. So
yeah.
I really like liver sauce by Quicksilver Scientific. It's very bitter. It tastes awful, but it's that bitter pathway.
Liver sauce?
Yeah.
What's in it?
It's like gentian, milk thistle, dim, some other things.
Okay.
And then I love my supplement, Tudka Max.
Okay.
It's NAC, milk thistle, Tudka, which stands for taurouracil-deocholic acid.
Okay.
The T in Tudka is taurine, which crosses the blood-brain barrier and helps with cognition. And then it has shilajit in it, so humic and fulvic.
Yeah.
Yeah. And I really use both those in combination with people.
And that helps the liver.
Yes.
Is there more structured liver detox that you like for people to go on or that you've recommended, or you think it's not really necessary?
I think it's not really. If I use those two in combination with nervous system dysregulation, along with GABA, along with minerals, along with B vitamins, I can really regulate people pretty quickly. And sometimes they don't need the full detox. They'll need half the time for the drainage and detox if I can get that right, because the body's a healing machine. I just need to get it back in normalcy. And then it's get this out of the body, get this out of the body. Oh, wait, we missed this pathogen, set off the inflammation cascade, kill.
Yeah.
It can't do that when there's haywire communication and cytokine storm everywhere. It cannot.
Should we be measuring cytokine storm? Is that helpful or is not necessary?
I think in some people it is helpful.
Right.
It's really hard it has different symptoms in different people. It can be hard to identify.
Yeah. I've looked at like some of the interleukins and stuff like that before and tried to measure them to see if it would help explain things a little bit better.
I mean, definitely Dr. Richie Shoemaker, who pioneered mold and his whole protocol, he looks at all that, right? The toll receptors, C3, C4, all the different interleukins. It's really important to see what's going on in the immune system when there's a cytokine storm. And COVID does something similar.
Let's talk a little bit. So while we're working on these different pieces, like the nervous system reset, drainage, detox, all the liver, all of this, the gut. A lot of people are coming in with maybe 4 or 5 medications that they're already on, or sometimes like 8 to 10 supplements that they're already on. How do you manage crisscrossing these worlds? Because sometimes the medications are necessary, right? But we also know that some of them impact the liver. How do we dance between these protocols?
It depends on what they come in with me on. If they come in on a PPI, proton pump inhibitor like Prevacid, I pretty much wean them off of that really quick. Because really people with acid reflux have low stomach acid most of the time, unless they have an ulcer. And when I add like digestive enzymes, betaine HDL, things can disintegrate and move forward in peristalsis rather than sitting in the gut and refluxing up. So the
PPIs apparently we were not supposed to be on for more than like 7 days, 7 to 10 days.
They almost fired me as a hospitalist because they wrote in the electronic medical record, this person's been on a PPI for 8 years. The package insert clearly says 6 months. And the PCP called and complained about me.
Oh, wow.
I wrote that in the chart because I was so mad. So I really hate PPIs. I really don't like statins, as you mentioned. So if they're on those two things, I pretty much take them off as quickly as I can in a safe manner and method. Other things like thyroid medication, they're going to stay on that. Right? It's pain medicine. If they have to have that, they're going to stay on that, even though I don't like it. And so I try and wean things off, and I get labs often, every 3 to 6 months to see what we're doing. Because sometimes if we give minerals, sometimes a parasite cleanse, we move people out of their moldy house, guess what? They start having hyperthyroidism symptoms because they don't need their dose of thyroid medication anymore.
Right.
Yeah.
What's your take on GLP-1s?
I used to be fully against them. But life doesn't work that way.
No, it doesn't.
It's not black and white.
It's not.
It's gray, and there's a gradient. And I really give a lot of credit to Dr. Tina Moore, who her Ozempic University, she taught a lot of people, including me. And I think everything is a gray area. I think some people really benefit from a little microdose. It doesn't even help with weight loss. It's helping with neuro and gut inflammation.
And all that stuff.
Yes. So I can't knock it. It's maybe not for everybody, and I don't like the high doses that cause gastroparesis. But at micro doses, I've seen amazing things happen for women.
It's where I really hope medicine will go, because I feel like there needs to be a micro medicine movement where some of these medications and pharmaceuticals are necessary for things like blood pressure or cholesterol or mental health, all for the short term, right? We need to be thinking about these medications. Actually, I'm going to say that again for everybody watching and listening. If you're on a medication, it should be a short-term strategy. It should not be a long-term strategy. So we don't want to throw all the pharmaceuticals out.
Right.
But one of the things that we've done a lot in clinic, and I don't know how you feel about this, is that we've been microdosing a lot of things. So you might get a pediatric dose of something. You may get a mini dose of something. That applies to the GLP-1s as well.
Love that.
And that way we're not overwhelming body pathways so that we are creating future detox issues, future heavy burdens of the liver, those type of things.
I mean, I think that's, in general, what they should be used for is a Band-Aid to the system until you get to the root cause. Right?
Definitely.
And then hopefully they don't need it anymore. Like, that's the beautiful part of being integrative functional medicine doctors, is our goal is where is the body out of normalcy, and where can I fix it, maybe with drainage or detox or nervous system regulation. So this just is a temporary Band-Aid for you.
Absolutely.
It's a beautiful thing to tell people.
And I think it's also, again, an empowering message, right?
Yeah.
Because I think a lot of what you're saying, and I can see the pushback, is that if we're saying your nervous system is the root cause, when we talk about root cause medicine, if we're going to say the nervous system is the root cause, there's a certain sense of responsibility that comes with that, because it's not this something out here that's causing this.
Right.
So I feel like throughout this entire conversation, you've been less concerned, and correct me if I'm wrong, with the individual toxins. You're less concerned with, the load of mold or a paraben or a phthalate or an organophosphate, for example, or glyphosate, like all these things that we're talking about all the time. You seem to be less concerned about that. Blue light, I'm going to throw in.
I love that you said that. Yeah.
So you seem to be less concerned about the bucket of toxins, which for somebody like me, I'm always like, but wait, the bucket of toxins is increasing. Our food quality is going down. People are using blue light more. They're up more, Tell me why you're not as concerned about that versus the nervous system and some of these other things.
Right. Well, I said in the beginning, the nervous system, if it's not in homeostasis, if you're in flight, fight, or freeze, it contracts and it doesn't release those toxins. If you're in rest and digest, the body feels comfortable to release. You
no
can
matter
sweat,
the load.
You can poop a lot more. Now, there are genetic considerations.
Okay.
There are epigenetic and genetic considerations. Yeah. There absolutely are. Yeah. We can't ignore those. But again, the genes are signaled by the environment. So there is some hope with that. I am concerned about them, but I look at it in different goggles than other docs. So rather than looking at the individual labs and spot treating labs, the individual problems or toxins on the total tox test, I look at where these toxins are stored in the body. What filter or drainage pathway in the body is not accomplishing its job? Why are, we can sweat out organophosphate pesticides. We can sweat out PCBs. We can sweat out BPA. We can sweat out certain heavy metals. So it's like, if your sweat pathway isn't working, you're holding on to a lot. Bile loves lipophilic things, fat-loving toxins. Yeah. The pathogens mold loves the bile. Yeah. Or the enterohepatic pathway because it's fat-loving. Loves the brain for the same reason. So a lot of people, estrogen problems, hormonal problems, itchy skin, mold problems, your bile is stuck. So I focus on how can I unstick those drainage pathways to get the body working again, because I can't fix you. I have to shake your body awake. Yeah. Hey, you missed this, right? Right. That's how I look at it with people, is piecing, I'm kind of pattern recognizing and Sherlock Holmesing their health by looking at their labs and putting the whole picture together for their drainage pathways.
And the key drainage pathways, just to reiterate that, are going to be things like
bowels, lymphatic, glymphatic, mitochondria.
Wait, what's glymphatic?
Glymphatic is the brain drain. So
How do you get brain drain?
Brain drain. Yeah.
That's a new one. Yeah. I haven't heard that one before.
So it was coined by, I can't remember the doc's name, in 2012. Okay. And it basically, it works while you sleep. Okay. The cerebrospinal fluid actually drains while you sleep, and it drains into deep cervical lymph nodes in the neck, into the lymphatic system, because everything's connected, right? So lymphatic bowels, lungs, kidneys, bile, sweat, cycles for women. There's a lot.
Those are the big ones.
Those are the big ones.
All right, we're going to knock through all of them with one tip for everybody out there.
I like it.
All right,
okay.
Here we go. Lymphatic. One thing you can do to improve your lymphatic drainage system.
I can give you a few. Breath, dry brushing, lymphatic massage, or, actually massaging the lymph nodes, the big six, they call it.
Okay.
Yeah.
Does gua sha count?
Yes. Yes, I love gua sha. Yes.
All right. Number 2. This is probably too easy. Bile.
So bile.
Improving your bile flow.
Yeah. I really like TEDCA for bile.
Okay.
I actually do coffee enemas sometimes with people, which improves the bile as well.
Okay.
So there's a couple different things. I use a lot of bile salts for that.
Okay. Third is, again, an easy one, kidney.
So hydration, really, really important. Half your body weight in ounces every single day of filtered, hopefully structured water. And kidneys hold a lot of fear in Chinese medicine as well. So it's really important to get hydration. I think it's really important to work on the fear and the trauma as well too. And really getting a UA every now and then, a urinalysis, to look at things too for
and
people.
See what's going on there. What are you looking for on that UA?
A lot of people have interstitial cystitis that I see. So it's actually a histamine-based problem. It's releasing histamine in the bladder.
Interesting.
Is what the issue is. But they'll think that they have a continued UTI, and they'll always culture it. So I want to see what's growing. If there's nothing and they're having a lot of other histamine symptoms, it's more of an interstitial cystitis picture for me.
Interesting. Okay, bowels.
So colonics, enemas, if I hit a roadblock and we can't get people open. Nervous system regulation, obviously you can't poop if you're not in rest and digest. And then I really like things like aloe vera. I love Oxy Powder by Global World Healing. It's oxidated magnesium. I love magnesium.
Amazing.
Miracle
what do I call it? Miracle micronutrient. That's what we always call it.
It sure is.
Okay, sweat. That's the most efficient thing to do.
Infrared sauna. Infrared sauna, my favorite. Honestly, people will tell me I can't tolerate the heat. I have POTS. I feel like I'm going to pass out. I'm like, we're going to trigger this pathway open. Just be brave for me. Let's get in 5 minutes. The first week, 3 times a week, 5 minutes. Next week, tack on 2 more minutes. And then we eventually break that sweat pathway open for them.
And then you mentioned taking minerals with sauna.
Absolutely.
Well, right?
Because if you are in nervous system dysregulation and your heart rates and blood pressure is affected, you don't have enough minerals. So I always have to add minerals back before I get people in the sauna and continue that through the sauna use.
Gotcha.
Yeah.
Okay, let's do one more list. I promise I won't do any more lists for you.
Okay.
Detox genetics that maybe impair your ability to detox as efficiently or make you more susceptible to the environment compared to somebody else.
Absolutely. So I mentioned one, which is a GAD mutation, which makes you convert GABA, the calming neurotransmitter, to glutamate, which is hyperexcitatory. You guys don't need that. And then the other thing is a CBS mutation, where they can't handle exogenous or outside sulfur-based products like glutathione.
Right.
Glutathione IVs make them anxious. Their heart rate starts going, and that's usually because of that mutation. I mean, another one that everyone's heard of is MTHFR.
Yes.
Yeah. So problems methylating, huge deal throughout the body, right?
Right.
A slow COMT, sometimes you don't break down adrenaline and cortisol as well. That can be hard too. There's also a lot of different genetics for histamine as well, right?
What are some of the ones that you've seen?
So DAO is one of them.
Yeah. Okay.
And that's the enzyme that actually breaks down histamine. So when it's released into the bloodstream, if you have low DAO enzyme, it's going to stay in the bloodstream and affect you longer.
Right.
And these people are usually the kids who should have been put in a bubble as a kid. They have a high allergy load, lots of asthma allergies growing up as well. And then sometimes that turns into food intolerances and full-on histamine problems later on.
What about some of the like CYP1s, A1, B1, some of the estrogen detox pathways?
Absolutely, that too.
Now, are all, like, let's say you get a genetic report and you've got like 4 of those. Can we change it?
Yes.
And again, back to how we started this conversation,
These
right?
are just enzymes. To get the function increased in them, we can do that.
Wow.
Yeah, we get these enzymes to speed up and slow down, for sure. Like MTHFR, right? That's an enzyme problem.
Right.
My enzyme got burnt out from stress over the years.
Fascinating.
Yeah.
Well, before we close out this super interesting conversation, I do want to touch again upon the role of trauma and grief and what it does to our physical chemistry and disease manifestations, and leave folks with something that they can do if they have gone through a traumatic season. Like, what do we want to tell them to do if they're grieving and having an issue there? Like, how do we help them move through that trauma so that trauma doesn't like live within their body, and then we're managing kind of all these other conditions?
You know, if you have had something traumatic happen, oftentimes it's like a snowball rolling down the hill that keeps picking up snow, and you don't know how to stop these feelings and emotions that feel so out of control. I know I was there personally, so I know exactly how they feel. I would say if you can afford just a few tests, blood work, and maybe a couple other tests to look at things like cortisol and your inflammatory markers, that really matters, because what the studies show is people in gratitude have lower inflammatory markers.
Wow.
And so that's a huge deal. You know, I mean, you can really change your methylation and your stress. You know, people hurt us, but people are the people who regulate us too. And they fix the problem. They are the solution and the problem. And so if you can find a good community of people that can talk to, that you can be vulnerable with, that you can trust, that's huge for people that are stuck.
I think that people that have experienced trauma often isolate.
Yes.
Or they wear a coat of armor to make sure it never happens again.
Yes.
And unfortunately, that is the thing that can make them sick, or,
amen.
Sicker. So I agree. It's especially as we go into maybe a holiday season or a new year, thinking about who that community is to make you feel safe, who are the people that make you feel safe, so that you hopefully can teach your body to feel safe.
Yes.
So you can bring down, like literally dial the knob down on what you're describing, that I call kind of this cortisol hum, in allow the body to get to this healing state, this parasympathetic state where everything can reverse. And I know that's all like easier said than done. So my hope is like find a healing community, start some practices that start to move this stuff out of your body, try things like neurofeedback, movement.
Oh my gosh.
And then use this quick cheat sheet that Dr. Jess just gave us, right? Like this quick cheat sheet to open up your pathways to drain more effectively. You're starting the process, but healing is always a process. It is never a one solution, one day thing. It's a start, stop. I made progress. I messed up. Let me start again. It's a constant journey.
It's never linear.
And it's not linear.
That's
by
right.
any means.
I mean, but the good news is that, like, I hope we gave people hope here today. Because
yes.
there's a way for you to heal. There's a little bit more responsibility involved, but like, you guys got this.
Yeah,
you can do it.
You definitely got this.
Yeah.
All right. Well, this has been so great. I've enjoyed this so much. And it's such a different way of thinking about, a lot of the diseases and stuff that we see in clinic. But I'm going to leave you with one more question.
Sure.
So what makes you whole?
What makes me whole? Community.
1,000%.
I have the best friends, and I have a great boyfriend, and I have a wonderful family. And so, like, I'm extremely blessed. I know everyone can't say that, but those people save my nervous system in the end.
And they make you safe.
Yes.
Feel safe as
yes.
well. Oh my gosh. Well, if people want to learn more about your work, what you're doing, where should they go?
So I always say there are levels to doing this with me. Depends on who you are and what you want. But I'm on Instagram and social media quite a bit, YouTube. So if Dr. Jess MD on Instagram, Dr. Jessica Peatross on YouTube. And that's free. I give a lot of information out to teach people on there. I really like teaching. I also lecture a lot at different conferences. I'm at Hack Your Health this next weekend in Tampa.
Okay.
And I have a community called Wellness Plus that people can do it themselves and it teaches this protocol that I've just talked about on this whole podcast. And then you can also see me virtually in clinic at Dr. Jess Health. And I have a whole team under there. So if you want to see me one-on-one, that's great too.
Amazing. Well, thank you for taking time out to join us today to talk about all of these very important things, especially in the environment and the issues that many of us are facing today. And for everybody else watching and listening, thank you for taking time to listen to us at Whole Plus. Don't forget, we post new episodes every week. All right, before you click away, don't forget to subscribe. It's free and it helps more people find Whole Plus. And if you're already here, why stop now? Watch the next video right here on the screen. It's one you don't want to miss.